morning, Mac Performance family. I'm Dr. Melissa McDonald. I'm a local area sports chiropractor here in Minnesota. And boy, over the last week, things have drastically changed with the environment of what we're looking at health-wise. So I was excited that I decided to just do an open forum Q&A. I'm going to make sure I have my live feed going. We're just going to answer some questions. And I fully admit I have been getting a lot of questions. So let me answer some of the ones that I have been getting recently. One, yes, I have decided to remain open. The World Federation of Chiropractic has put out a position statement concerning COVID and its pandemic effect on the population. And here's what's going on. Hospitals and emergency rooms are inundated with patients experiencing symptoms of either COVID or the regular flu. And they are not going to be able to take care of someone that has musculoskeletal pain, low back, headache, knee, ankle. They just aren't going to necessarily have the resources, nor if you're not sick or quarantined, or you necessarily want to go into that environment. So I've decided to keep my clinic open so that if people have pain, they can get emergent care. Now, things that I'm doing to help mitigate the problem. I am making sure that I'm keeping my rooms extra clean. I am only having one patient in the office at a time, and I'm putting a 10-minute gap between appointments so that I have one, time to clean and do a full end-of-day cleaning between each patient, and two, make sure there's no interaction between people. I'm also going to be wearing gloves, and if you have a cough or sneeze or any symptoms at all, I'm asking that you don't come in. So that's what I'm doing to help people keep safe. I see we have some people on with us. Hi, Tim. Welcome to the live stream. I really want to make sure to understand I am taking this very seriously, but I also want to be a resource to people who potentially get injured. They're in different environments working. When you're used to working at a desk ergonomically, when you work from home, you might not have the most ergonomic situation going on. So you might have an increase in neck pain, an increase in headaches, and that's what I want to be there for people. So I don't see any questions yet. I did get asked a question about a very specific adjustment on our Instagram, and the adjustment was for an anterior lumbar. So basically an adjustment through the belly to the front of the low back. Could they do it to themselves? And the answer is, I don't know. I don't think so. I haven't quite figured out how you would do that to yourself without some equipment. So I'm going to have to go with a no on that one. But I do understand the necessity of the adjustment, especially for females and low back pain. So just thought I'd throw that out there for you. When it comes to medical questions tonight, I really want you to be able to get whatever answers you need. If you're asking live, hashtag live. If you're watching this on replay, go ahead and hashtag replay. I'll be happy to go back and answer your questions. You might notice I'm in a different environment. I'm not actually in the office right now. I'm at my home, and that's because the university I teach at is closed for the next 2 weeks, and I wanted to test my setup for how I'm going to be lecturing to my students tomorrow morning. And I figured this was as good a time as any to practice my setup in a different environment. So thank you for being my test subjects. I see we have Steven and Tim and Andy. Thank you for joining. Again, if you have any medical questions, I know right now a common question I've been getting asked is, why is everything closing? Why is everything getting canceled? There's not that, I think right now in Minnesota there are 60 cases, at least the last time I checked there were 60 cases, and that seems a bit extreme to be canceling everything. And I have to look at it from my EMT perspective. So I'm also as well as a chiropractor, an emergency medical technician, and the first line of responders. Right now, there is a limit, there is a finite amount of patients that our health system can support. And we are still in peak flu season or influenza season, and there are a lot of patients seeking care. Now we've added a new virus that, in all appearances, no one has immunity to. So I'm sure you've heard the term flatten the curve. That's really all we're trying to do. We are trying to prevent the number of people seeking care or having symptoms from hitting the hospitals all at the same time. If you've seen what's going on in Italy, they didn't do a very good job of flattening that curve. And in all honesty, when you look at the national average, not just local, but if you look at the whole country, we're not doing a great job. We're basically following the same track of cases as Italy. So the stricter and more quarantine options, that's kind of what's going on. I do know back home in Michigan, my parents just had a report of COVID in Otsego in their church because of a mission trip. And they know that some of the people that were on that mission trip that were recommended to quarantine for 14 days just to make sure no one developed symptoms haven't been as diligent. So although it is an inconvenience, if it has been recommended to you to quarantine, it is important. Now, you might be going, but you're keeping your office open. I am, but I'm going to be following CDC recommendations for cleaning and protective equipment. I have purchased gloves and masks that I keep with me at all times. When I'm working sidelines, when I'm working events, I sometimes have athletes that are sick and I just have them on hand. So it wasn't something that I had to go out and stock up on. I just had them at the time. And it is one of those things that if I or my husband developed symptoms, or if a patient that had been in the office reported having symptoms, I would alert everyone and I would, of course, then quarantine, because that's what we would have to do. Or if something drastically changes. I haven't looked it up officially, but I think there's something in our statute as emergency medical technicians here in this state that if in a national or state declared emergency, we can be called to essentially active duty. If I get called into a frontline position in a hospital or on an ambulance, my clinic will be closed for safety reasons. So it is definitely something that is top of mind for everyone as they're having to make life adjustments. I know for our family, the hockey rink situation has been the biggest kerfuffle. My husband doesn't do well without hockey, for those who know him that have tuned in. So again, if you're watching live and you have any questions, go ahead and message below. It can be musculoskeletal. It really can be anything medical. If you ask me a Jeopardy question, I'm probably going to look at you funny. I'm not very good at those, even though we watch Jeopardy all the time. But I do know that what's going on right now is incredibly unprecedented. The last time we had some form of pandemic like this was in 1918, and most people who were alive at that time were too young to remember and or have since passed on. So, well, it doesn't look like many people have questions tonight. So let's just do some general things that you can do at home if you're working from home to keep safe and not have any pain or issues. So check out the ergonomics of the area that you've decided to work at. Try to keep your arms, elbows at 90-90 to reduce any stress on the nerves that could cause carpal tunnel syndrome. So if your table's too high or your seat's too low, try to balance those out so that when your arms are resting on it, your shoulders are still hanging at that 90-90 realm. Like right now, the desk I'm sitting at the chair angle, it's too high and my chair's too low. one of the two. And if I sat here for too long typing, I would develop some carpal tunnel. So try to use as best ergonomics as possible. Try not to do as much computer work sitting on your couch. Granted, I need to take my own advice on this. It is kind of important to use appropriate ergonomics. We do have a PDF for how to do some neck stretches. We also have a YouTube video that are posted to our page that you can access and utilize to help keep you healthy at home with things changing. Whenever our bodies change, we don't like it at all. We get stressed, we have pain, and then we don't function as well. So trying to take the time for yourself. We are doing yoga here at home. To Andrew's chagrin, I'm making him do yoga, but vice versa, he's writing programs for everybody to work out with every day, and we're doing those as well to keep active and stay fit, since the gyms and all recreational things in our area have closed. Restaurants have closed, so really, if I'm not at the clinic, I'm at home, which I think is where most people are. And I have, hey Jess, happy St. Patrick's Day. Good job on doing yoga today. Yes, yoga is fantastic. If you're looking for yoga online, there is the YouTube channel, Yoga with Adrian, not sponsored. I just really love it, and it's free, which for most people, that kind of works out. I think she does a really good job of kind of gearing it to what you need. She has it divided up in her subscription to be either by minute or by activity or level. So if you just want a quick, easy 6-minute yoga sessions, she has 6-minute yoga sessions. If you want to do a hardcore 2-hour strength yoga pose where you're holding things for like 5 minutes at a time and crying while doing it, she has those too. So there's just a variety of different levels within that. I don't even know what to say exactly when it comes to this is where we're at right now, and it is insane when you look at the type of changes and modifications we've had to do and learn basically overnight to keep the infrastructure of this country running. And I think ultimately we've done a pretty darn good job. Yes, there's been a lot of layoffs, especially with the food industry, and I feel for them. My husband's laid off again since he's a coach and a trainer and a hockey ref, and all those things have closed. So we definitely feel for people in this time of what's going on. Has there been any questions concerning medical issues? If not, I'll probably sign off a little early tonight. I don't want to keep dragging you on. Ultimately, I think the biggest thing we're going to need to do is stay physically healthy, stay mentally healthy, and try to eat healthy. And that can be challenging, especially if you are eating non-fresh or preserved foods. But if you stay physically healthy, get enough sleep, moderate your stress as best possible, we will all be fine. It should blow over in a month or two, and we'll be back to the new normal. Whatever that new normal is, we'll be back to the new normal. So I want to thank everyone who tuned in tonight. We'll do another live next week. Haven't quite decided on the topic. I will post it by tomorrow what that will be. I think it's going to be on home fitness and staying active and how you can modify different pieces of furniture and luggage and books to your advantage so that you can stay active. Unless someone else has another topic they're dying or burning to hear about. So until next time, here at Mobility Agility Chiropractic Performance, we hope that we can keep you better longer, get you better longer. Oh gosh, I can't even do my slogan tonight. We want to get you better faster, keep you better longer, because no one has time to be sidelined. Have a wonderful evening. Thanks for joining in. If you do have any questions, hashtag live or hashtag replay and ask them. I'll get back to them as soon as possible and answer them if you're watching this on replay. Have a good night, everyone. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.